My name is Glynna. I'm 49 years old, and I live in Boerne, Texas, which is not very far right outside of San Antonio. The first time I heard about breast cancer, I was in middle school, and my mother came home and told us that she was diagnosed with breast cancer. She was in her early 40s at the time. So that's kind of when the journey began. She had a mastectomy, and then she had chemo, and she did amazingly well. She went to work the whole time she had chemo, and so she was a great example for me. So breast cancer never really scared me. But 22 years later, she got breast cancer again, and when it returned, it was in her bones, and that was a terminal case at that point. Her sister also got breast cancer in her 50s, and it returned in her bones after 25 years. Again, she was diagnosed terminal. So it was never the first thought of getting breast cancer that scared me. It was always when it returns. So in my early 20s is when they started checking me for breast cancer. I had had 42 mammograms, 37 sonograms of my breast, 5 MRIs, 6 biopsies, and 1 lumpectomy, and a galactogram. You don't even want to know what that is. And that's in my 49 years of life. So in October 2016, I go in for my checkup, and they again found another place. So they recommended a sonogram, had a sonogram, and then they recommended another biopsy. So I had a biopsy at that time. Biopsy came back negative. It looks odd on the mammogram. I really want you to get another opinion. I want you to go to a breast surgeon. So when I went to see him, he said, Glynna, I agree. It's benign, but I don't like the way it looks. I recommend you have a lumpectomy, have it removed. And I asked him at that time, I said, I'm pretty done. I'm tired. I feel like I've done this my whole life. I'm already 48 at that point. Would I be a candidate for the prophylactic double mastectomy? And he said, absolutely. He said, but you need to go talk to the expert. And he sent me to Dr. Nasala. And my first visit with Dr. Nasala and Amy, I've never had so much information at one time. They were so supportive. He told me that I was absolutely the perfect candidate for a double mastectomy. My next thing was I did not want implants. Why? I don't even have a good reason for not wanting implants, but I just felt like I'd always worried about my breast tissue health, and I really didn't want anything artificial in there. And he said, well, that's not a problem either. You're a perfect candidate for the DIEP flap. So I had a prophylactic double mastectomy with a DIEP flap. After it was approved by the insurance, I set up an appointment. So March 28, 2017 is when I had my surgery. And to say it was pretty much a breeze is actually true. I came out of it. I do have a high tolerance for pain, but I never really had any pain. The next morning I was standing up in my room when PT came in to get me out of the bed, and I'd already walked around the block and was standing up. So she's like, their services were not needed. Had an easy recovery. I went home. I had been home 7 days, or 7 days after the surgery, I got a call, and he told me the tissue they removed during my surgery had come back from pathology, and I actually had stage 0 breast cancer. And he was so excited. I'm like, why are you so excited? And then he started telling me it was a miracle. He said, you don't understand. We don't find it at this stage. We just don't find it at this stage. And I said, so what do I have to do now? Do I have to have chemo? What do I have to do? He said, absolutely nothing. You've been diagnosed and you're a survivor all in the same day. And that's when I started to realize what a miracle that was. That was the same spot 6 months ago that was considered benign. And he felt sure that in 6 months, which would have been October 2017, that at that point they would have diagnosed me with stage 1 cancer, which means then I have to worry about the cancer in the future in 20, 25 years. So that's why I feel like it's been a miracle. The reason I would love to tell my story, and I tell my story to anybody that listened to me, is because my mother, when she was on her deathbed, her doctors recommended that she have the BRCA test. And she was tested, and she tested gene negative. Her sister's also gene negative. They said the chance that I would be gene positive is absolutely none. But they recommended I have it anyway to help my insurance pay, because they didn't want to pay. So I've had the BRCA1, I've had BRCA2, and I've had my risk, and I'm gene negative of all 3. But it didn't work out well for my mother, nor her aunt, and it didn't work out for me. So what I always tell women, if you have a strong health history, a family history of breast cancer, of course get that gene test, but you got to take it with a grain of salt. You got to stay active, proactive for yourself, you got to surround yourself with the best doctors that not only look at that negative, but also look at the family history and encourage you to stay on top of your health. Because I was the proactive patient. And if I had sat back and just thought I was okay, then I don't know that I'd be here today giving you my story. So this is my story.